caused by that. Now, having said that, we do a lot of negative ultrasounds when patients come in, complaining of these symptoms, but it's still worth it to find the cases that could be potentially curable.
So if you're having leg cramps, but you have nothing visual on your skin, it could still be venous insufficiency.
Yes, because like between 20 to 30% of patients who have venous insufficiency don't have big varicose veins, or don't have any varicose veins.
Mm-hmm. And that would be diagnosed with a scan?
It's diagnosed with an ultrasound.
Ultrasound.
Okay. Most people come to you for cosmetic reasons, because the legs look bad, or is it because it's a medical condition?
No, most patients come because their legs are bothering them, and they hurt, and they actually come on their own through friends, seeing finding the vein center on the internet, because, and this goes back to doctors are hesitant to send their patients for the procedure, to get evaluated for the procedure, because they think it doesn't work and they think it's cosmetic. But it's to the point where patients are bothered by it so much that they're seeking treatment on their own.
Mm-hmm. So let's talk a little bit more about their treatment options. Someone comes to you, they have a lot of pain in their legs, and venous insufficiency is diagnosed by the ultrasound. What happens next?
Well, let me just talk about the ultrasound, because I think that's extremely important.
Okay.
The venous ultrasound has really revolutionized the diagnosis and treatment of venous insufficiency and varicose vein disease. And it's important when patients are looking to have treatment and get evaluated for this, that they find the vascular lab or vein center that has a certified tech. There are certain levels of tech certification of doing ultrasounds, and having a certified vascular tech, I think, is extremely important. And having a what we call an ICAVL approved lab is extremely important, because right now there are a ton of people doing veins, and because it's just, in lots of offices, they look at it as another revenue stream. I think it's extremely important that patients do a little bit of homework to find out where they're going, and that the lab that they're going to is accredited, and the people that are performing the scan and also doing the procedures are qualified to be doing it.
I think people have the misunderstanding that ultrasound is similar to an X-ray. They don't realize that the technician has to have a lot of skill in order to get a correct picture.
You're 100% right. They have to have skill, and they have to have an understanding of what they're looking for. Mm-hmm. And going to, because I see lots of ultrasounds from other offices. We always repeat our ultrasound, and it's very, very common that what we find and what we see on the report from the other labs are different. Mm-hmm. So I think that is critical to, because that's how you make the diagnosis, and that's how you're going to map out your treatment for the patient.
Mm-hmm. There are probably many people who walk around with this condition and elect, or for whatever reason, don't treat it. What might be the consequences of not treating the condition?
It's not a problem. You're not going to die from varicose vein disease. If you have varicose vein disease, there's a very low incidence of increased risk of having a deep vein thrombus, a deep vein clot, but it's pretty low. It's just a quality of life issue, and in its very late stages, in a certain percent of cases, patients will form a leg ulcer.
Quality of life issue, meaning the pain you're going to endure,
the pain,
discomfort.
Yes, and it's quite significant in a large majority of patients.
When you say pain, is it pain at rest or pain when you start to walk? And if it's pain when you start to walk, walking is good for you. You might not do it because it gives you pain.
Well, it's achiness, it's pain, it's fatigue. The legs are very heavy. They get very swollen. There's at the end of the day, and there's the walking is going to help it, but when you get to that point, the walking is not going to do much for it.
Okay, so what are my treatment options? I've come to you. You've put your ultrasound my legs, and I have venous insufficiency. So what kind of decisions do I have to make about treatment?
Well, what you'd have to the first thing we would have to do is we'd have to talk about compression stockings and wearing compression
those
stockings.
unattractive stockings we talked about.
Unattractive.
She's already ruled those out. Next.
Well, I would do them in the beginning.
Well, you'd have to do it because the most insurance companies require a 3-month trial. of
Okay.
that before.
You have to try that
Yeah.
before they cover anything else. Gotcha, okay.
Why do you think they do that?
It's the most conservative treatment.
No.
Less expensive?
Well, it's less expensive for them. It's a form of denial of care because
Yeah.
they know if they're going to put
Yeah, it's
people
less
in
expensive.
stockings,
Give
you
you-
know, a
give
lot
you
of
a-
people aren't going to have
Give
the
you a pair of
procedure after
socks
3 months,
instead
right.
of paying for the procedure. Gotcha. Okay.
Even though they don't pay for the stockings either, it's usually not covered.
Oh, it's
okay.
not covered.
No, usually not.
And do they work for some people?
Yeah, they may work for some people and relieve their pain a little bit, but patients are not going to want to be wearing stockings for
Forever.
the rest of their life.
And the
to take-
underlying condition is still there.
It's still there.
Oh, it's not going to go away.
It's not going to go
It's
away
just going to relieve the pain temporarily.
for when they're wearing the
Oh,
stockings.
okay.
It's not going to make, and it's not going to. The disease is going to continue. It's not
It's
treating.
progressive,
Yeah,
basically.
even with wearing the stockings,
Oh, okay.
it will just make your leg feel, in certain patients, a little better when you have them on. So what we would do is we would treat the, to treat the disease, you have to remove the incompetent vein from the circulation. And, you know, like I said before, in the old days, they used to strip out the vein, so people do
Right.
it now. Well, what we do now is we close the vein with the laser. And the way we do it is it's all done.
You don't remove that?
No.
Oh,
What we do is we would close the incompetent vein. Now we get back to that great saphenous vein, which is under the skin, which you don't see in the fat. We do that using ultrasound guidance. It's all done in the office. It's a local procedure. We map out the leg. We draw a line along. We usually do it from the knee up into the groin,
Okay.
where it goes into the deep vein, the great saphenous vein. And then what we would do is we put a little needle in, and then a wire, and then a straw inside of the vein. The laser fiber goes through the straw all the way up the vein into the groin. Then using ultrasound, there's a little sheath around the great saphenous vein. We put local anesthesia around that sheath, and that compresses the vein and also serves as a heat sink for when we turn on the laser. And then the laser gets turned on, and the heat of the laser destroys the vein. It destroys the inside lining of the vein. The laser gets slowly pulled down until it's out, and that section of vein is destroyed. Then, for the bulgy veins that you see on the skin,
Right.
we mark those before the procedure. We numb up the leg where those little tiny veins are, and we take those out with little tiny incisions. And that procedure is called a microphlebectomy.
What happens then, or doesn't that compromise the circulation, the return circulation in your leg? What happens?
No, it actually makes it better. I'll explain why.
Oh, okay. I would think if you're taking something out, it would compromise.
It actually makes it better. It's actually the opposite of what you think
Right.
think about when you're thinking about the venous circulation, because what's happening is the veins are diseased, and blood is going in the wrong direction in those veins, so it's causing a problem. So when that vein is removed, the blood gets channeled to the veins that are working, and the leg gets better, the swelling goes away. Usually, in most cases, we've had patients who their ankles went down 2 inches after the procedure. The color of the leg gets better,
So
and the symptoms
other
go away.
veins take up
Yeah,
the job.
the veins that are working, because this is what's causing the problem. I mean, it's causing the swelling. So when you remove that, see, it's a little bit different when I used to do heart surgery. That's the vein we always take out for the bypass
Well,
operation.
that was another question
I'll talk about that.
Yeah.
And then when we did that, the leg got swollen because those were competent veins. Those were working veins. And when they got removed from the circulation, it took time for the body to form new veins to be able to take the blood back to the heart. So this is just the opposite.
aren't those veins sometimes used in bypass surgery?
Yes, they are. That's one of my favorite questions. I have lots of patients who said, well, I don't want to do this because I may need this for my heart operation. But what happens is, and I've seen like thousands of diseased varicose veins, they're not usable for the procedure
Oh, so then,
because the veins are too big. They get dilated and they're very large, and they're not suitable, what we call conduits, to use for the bypass.
Not to interrupt, but we have a minute left. Is there anything we can do to prevent varicose veins?
and venous insufficiency.
There's nothing to do to prevent it. The best thing people could do is be active. I think if patients have some discomfort with their legs, they can wear compression stockings, but I think early diagnosis and treatment is actually the best way of dealing with the problem.
And when is the correct time to come to somebody like you?
Whenever anybody is feeling that their legs are bothering them.
And it's getting tough to tolerate it, I guess, quality of life issues.
Yeah, I mean, you don't even have to go that far. I mean, whenever it's the point where it's something that's affecting your quality of life, what you're able to do, it's the time to get evaluated.
Very good.
Well, that said, we thank you for joining us. You were a terrific guest, Dr. Fleisher. For more information on conditions affecting the veins in your legs, talk with your healthcare provider.
If you have either a question that you would like answered during a future health talk or a topic suggestion, please email us at healthtalk@sshsw.org. Join us next week and every week at this time when Sound Shore Medical Center presents health information for your good health.